Greetings, everyone. Once again, we want to welcome you to today's session. We're going to be discussing one of those fractures that I'll call in the upper limb, still continuing our fracture nights in Dr. Gerald's Health Line. I want to say that today we're looking at fractures around the forearm region. The forearm region is that part of the body that is between the elbow and the wrist. And there are two bones that are pretty much located in this region. The two bones are called the radius and the ulnar bone. Now I have a mannequin here trying to describe this part which I'm talking about here is the radius bone, and then this one is the ulnar bone. This is exactly how they are positioned, and then you have something in between which is the interosseous membrane that holds the two bones together and allows them to function in unison. Now these two bones can fracture. Very commonly we have the fracture of the radius or the fracture of the ulnar. Now any of these fractures that occur, the usual thing is that the patient would have had a history of pain and the issue of swelling around a particular arm. There is difficulty in using that particular upper limb to make or do the usual functions, and then you now have the person presenting to the hospital. Now most of the patients sometimes in our region, when they have these conditions, they try to manage them at home. I want to tell you that this is very dangerous and can lead to deformities that can be long lasting. And these deformities and complications that arise can be preventable, just as we've talked about in the previous sessions. Now if you have a fracture of both radius and ulnar, and you have to see immediately a doctor. Now you have to see an orthopedic surgeon to examine the individual. If there is need for resuscitation, that will be done, and go ahead to do the required investigation, which probably will require to do an x-ray. And now when the x-ray is done, the particular bone is shown, and that will reveal to us the region of the fracture. Now the fracture can occur anywhere from the proximal part of the bone. Now looking at what we have here, okay, this is the part that makes contact with the humerus, forming the elbow joint. So the fracture can occur anywhere around there, or it can occur on the shaft, or it can occur at the distal part of the radius. Now I want to let you know that most commonly when these fractures occur together, sometimes we can manage them conservatively without having to operate, but better still, you have better outcome when we do surgery for some of these cases. And so no matter what you're told to do, that's why I'm here trying to talk about this, so that it is that you're hearing from someone who understands this condition and you can take the right decision. Most people, you hear them say they are afraid that they will cut their hand, and that's why they didn't go to the hospital, and then you have them develop complications that will arise. Now I'm going to talk about some of those complications by the end of this particular session. So I want you to listen in. So what I'm talking about is that you may need to see the orthopedic surgeon, and once it's decided that there's a fracture and there's need for you to have surgery, or they're going to manipulate it under image guidance and put in a cast, then you should go ahead and let it be done for you. Having asked all the necessary questions, it will be good for you to go ahead and also follow the necessary instructions that you are given. All right, we've talked about in some other series, I've discussed the complications that can usually follow when you have injuries affecting the upper limb, and some of those complications would entail things like stiffness of the joints. Now that's very important, especially the hand joint, the wrist joint, and the elbow joint. I said some time ago in that series that the elbow is very much unforgiving, and so that is why you see sometimes we want to go ahead and open up that particular part of the body, the arm, and fix it so you can have to resume function earlier than you would have if you had a cast that was immobilizing that joint. So this is exactly what happens in those cases. And I want to say that for the surgeries where you have one of the bones broken, that's to say in this case you have either the radius broken and the ulnar is intact, or you have the ulnar broken and the radius is intact. If you have that situation, I want to tell you that it's most of the time one of those cases that will require us to operate. Okay, it's one of those situations that we may want to go in because one of the bones may be a splinting factor to the other and not allow it to heal. And so that may require you operating. Now that depends on each case. Every case is treated as an individual case, and that is why you see the surgeon will request for an x-ray before he takes that decision. So I don't want you to just lump it up together and just decide that this particular thing has to be done for every case. Now once you present yourself to the hospital, see an orthopedic surgeon, you can write into us, you can send us your x-rays, you can ask questions so that you are guided and to make sure that you get the right treatment and come out with the best result. Now, I just want to say that going forward, looking at the fractures that occur at the point where we call the shaft between the radius and the ulna, something very particular happens. Now, when there's a fracture at that region, okay, usually this will occur when you have a fall from an outstretched hand, maybe somebody who's trying to break a fall, or maybe when you're trying to defend, the person is trying to defend himself from a baton hit or any traumatic injury, that will result in the fracture to that particular part of the hand. Now, when this happens, if it is a closed fracture, we can manage with any of these, what we've talked about. Now, if it is an open fracture, then we are very much interested in taking care of the wound. And so you may see that the doctor may have to temporize in what he's using to fix the fracture. We may want to put an external fixator in that particular bone and then manage the wound before going ahead, because once it's open, sometimes we don't want to go ahead and fix because of the risk of infection. So I want you to have this in mind, and this is one of the things that affects our decision. Now, what could happen if you go ahead and manage this at home just by applying splints? Okay, now those who go ahead and apply splints may have the problem of this. Now, when this fracture occurs in between these two bones, okay, there is usually a movement that takes place, okay, in the forearm region, and that movement allows for now pronation and supination. Now that's the movement I'm describing, okay, pronation and supination. Now, when you have that, movement in the hand, it allows the hand to function effectively. But when there's a fracture, okay, and there's the bone breaking at the points, okay, in between, you have accumulation of hematoma, that's blood accumulating between. And if not properly treated, all right, these two bones can fuse, what we call synostosis. And when this occurs, okay, it prevents that movement of being able to pronate. Okay, it prevents that movement of being able to supinate and pronate. All right, so bearing this in mind, it becomes very clear that you need to get the best advice, okay, from an orthopedic surgeon to be able to get the best result. And that is why we're coming to you on Dr. Gerald's Healthline, encouraging you that when you have any fracture, a relation or a friend, someone who has this particular problem, it is important that they present themselves to the hospital and not commence from all forms of home treatment that can result in the stiffness and dysfunction of that particular hand. So this is one of the things we want to talk about on this particular topic. So we've looked at fractures that occur around the radius and the ulna, around the shaft. That's the one we talked about today. Going forward, I'm going to look out in the next series. I'm going to be talking about fractures that occur at the distal part of the radius. Now that is closer to the wrist. Now this is the most common kind of fracture that occurs in the elderly, especially in females, and usually occurs following a fall. So I want you to watch out for the next series. We're going to be discussing that fracture. It's a very common fracture and you need to hear about it. So what have we said today? In Dr. Gerald's Healthline, we are saying that you should make sure you present yourself to the right place for you to get the right care. If you have a fracture affecting the forearm region, which is the part between the elbow and the wrist, go and see an orthopedic surgeon. You can write into us, you can send us your messages or calls. We've been attending to some of you, and I know that you've had good time, hearing what we have to say. And I hope that those information helped you to make the right decision concerning your health. Don't fail to write us, to give us comments on our box, our inbox session, so that we'll be able to know how much this information we are sending out is helping you to reach out to, or to help you take the right decision for yourself and for your loved ones. I want to say thank you for tuning in today. We'll look forward to hearing from you as you write us in. Watch out for the next session. See you soon.